Hi everyone, I just wanted to make a video today. I hope everyone is keeping well. This video today, I just want something that's kind of close to my heart. I just want to talk about is the safety of women in Irish hospitals. I just want to talk just briefly about my own experience. I was in the hospital last year. I had to have surgery, and after having the surgery, a male nurse assistant did come into the room to wash me, which I found just very, very disturbing. I just couldn't even believe that this was happening in our Irish hospitals. I suppose when you're not in hospital and you haven't been sick, you're not aware of what's happening or what's going on. Now, I didn't allow this male nurse assistant to wash me, but I just was traumatised by the whole experience. I thought it was horrific. You know, when you're sick, you're very vulnerable. You're, especially after surgery, you're in pain, you're sore. And the last thing you want is to feel unsafe or to be in that position where a male nurse's aide, or it could even be a male nurse, comes into your room and wants to wash you. To be honest, I thought it was absolutely nuts. And I was absolutely shocked just at the state of the care in our hospitals here in Ireland for women. Now, I also witnessed a lot of stuff while I was in the hospital as well that I found extremely disturbing. And I just want to share this other story which I witnessed as well. I was on I was moved around a lot of wards for my stay in the hospital, and I was on another ward where there was a woman. I'm trying to think what age she was. Now, she wasn't very elderly. She was older than me, but she wouldn't have been very elderly. She had her full faculties. And again, it was a male nurse assistant and a student nurse that had come in to wash her. And I could see she was very uncomfortable and she didn't want to be washed. And subsequently, the curtains were pulled, she was washed. And after, when they went away, she was crying in the bed. And I just found this very disturbing. Couldn't believe what I was after witnessing happening to this woman. And it just takes you a while as well, like, to process this, what you're seeing. You know, it's kind of, for all the world, like, it is surreal. Like, I never knew myself that this was going on in the hospitals here in Ireland. I also had another experience where I was visiting a family member, and I witnessed with my own eyes a woman who had dementia, and a male nurse's assistant and a female nurse's assistant went in to change this woman's nappy. The woman was highly distressed when they were doing it, and she kept telling them, you know, don't touch me, go away. And I just was absolutely cringing hearing this going on, and I was absolutely shocked and appalled to think this is the care that's going on in our Irish hospitals. Like, we're in the 21st century, and just to think that women were not safe in the hospitals, and you know, we this has to be, you know, addressed and spoken about. It took me a while even, like, to come out and talk about this, because it's not something that's easy, I suppose, to talk about. And I think, like, I said no that day when the male nurse assistant came in. I didn't want to be washed by a male, and I certainly wouldn't feel comfortable being washed by a male. And I just think what's happening to a lot of people, as I said, they go into hospital, they're sick, they're vulnerable, they are probably in pain, they're not feeling well, and, you know, they have these experiences and they get out of the hospital. It's kind of like, you know, your mind just wants to shut it off, like, and pretend, you know, like it didn't happen, even though it did happen. And, you know, you're trying to deal with your illness as well and your recovery. And a lot of people don't speak out. But I think people have to speak out, because I think this needs to be addressed in Ireland, is the safety of women in our Irish hospitals. I just can't believe now that we have male nurses and male nurses' aides coming in to rooms in Irish hospitals doing very intimate, like bathing, changing nappies, and I suppose God only knows what else that they're doing, but this shouldn't be happening. And I firmly believe this needs to be addressed, and it needs to get out to the public, and people need to start talking about it. And if you're a woman and you're watching this video, you know, please share this video with all your female friends. You know, share it with your mother, share it with your sister, share it with your daughter, because us as women, when we go into the hospitals, we have to feel safe. That's paramount. And I don't know what happened to the hospitals along the way. Now, we know that they are in an awful state in Ireland, but this is very concerning and it's very, very alarming. And I just want to share, I was just been doing some research on this, and I just wanted to share some stuff with you as well. And it's here just saying medical patient modesty and risks of gender neutral nursing assignments. And I just want to see here what they say. They say here that many patients and family members are unaware about how gender neutral hospitals have become until they or a loved one is hospitalised, which is so true. I mean, you're going about your daily life there, and you know, a lot of people don't know what's going on inside the hospitals. You know, you have to end up, unfortunately, in that position of being sick or needing surgery to be in the hospital. And then, as I said, some people witness things and they're so traumatized, you know, that they come out, they try and switch it off, block it off like it didn't happen, you know. But we have to have this discussion and we have to speak about what's happening for the safety of the women here in Ireland in the Irish hospitals. And I just want to say, it says, today it is very common for a male nurse, for example, to give a female patient a bath or to administer intimate procedures, example, urinary catheterization or vaginal prep for surgery, without, now listen to this part, without the patient or family's knowledge or consent. And I think that's very important. Male patients also endure intimate care from female nurses against their wishes. And I suppose it's very important to mention that as well, because you know, I don't want to be all one-sided here and just say, you know, only women are victims. Obviously men are victims too. Like, if a man is in the hospital and if he feels uncomfortable or he doesn't want a female bathing him, you know, he has that right too. He should have to ask for, you know, a male nurse assistant or a male nurse. So I don't want to make it just, you know, like all one-sided, that this is just a complete women's problem, because it's not. But the problem is, I suppose, from the female side of it is, if you go to the statistics, like, it's more than likely a woman is going to get, you know, sexually assaulted by a male. There's very few, I mean, the numbers, I suppose, for female sexually assaulted males would be so much lower. So we just want to put it into context as well. I just want to go further down as well, just to share with you some other people's thoughts here. And this person says here, a male nurse has to assist in bathing some women for the purpose of lifting them. Now, what they're doing here is they're just arguing that sometimes hospitals, like, they use that argument, do you know what I mean? That, oh, well, we can't lift the person, so, you know, we need a male. Now, that's fair enough. The male could help with lifting, but then walk outside, go outside when the intimate part of the procedure is happening, like if it's changing a nappy or if they're being bathed, do you know what I mean? I don't think there's ever an excuse where a hospital can say, you know, we had to have a male there present. There isn't really. And we all know, like, in the past, I know from past experiences in hospitals, like, there would never ever be a male nurse assistant bathing women, changing women's nappies. It's just, I just absolutely think this is horrific. I think it's just so demeaning to women, because, like, when you go into the hospital, you're entitled to have respect, dignity, you have human rights, you have patient rights, and I feel like they're not being met, and I feel like this is a big elephant in the room that needs to be spoken about. I just want to go down here as well and just say, these are just other people here writing in stories here, and I'll just share this one here with you. A son who was disturbed about his elderly mother having a male nurse. My mother, who was hospitalised with a broken hip. She was in the advanced stages of Alzheimer's. One day I visited her room to find a male nurse cleaning her up after a bowel movement. She was highly agitated and terrified. My dad, who was present, had not protested, so I didn't say anything. I cannot believe that I was such a coward. Mother passed away 5 years ago. I've not gotten over the regret of not speaking up for her. Given the opportunity again, I would have insisted on female nurses and aides only. Yeah, so like what I would just say to people, don't be afraid to speak up. You know, if you're watching this video today, if you have a family member that's in the hospital, if you have a family member that's in a nursing home, or you have a family member that's a female, you know, don't be afraid to speak up either. If you see something that you're not happy with, you know, speak up, get that courage, because the person that's in the bed, the patient, they may not be able to speak up for various different reasons, and you are their advocate. So please speak up for your loved ones when they're in the hospital. And I just want to go down here. There's another one here. A college student shared this about her grandmother. I have a grandmother in a nursing home that requires help bathing, changing and assistance in the restroom. She's also not completely there in her mind. She can easily be taken advantage of and cared for by a male. The position my grandmother is in is already degrading enough, but to have a male nurse taking care of her and seeing her exposed is wrong in many ways, which I totally agree with. My family does not want to have a male nurse taking care of her because of the degrading and immoral nature of the situation, which I totally agree with. So, you know, particularly the vulnerable patients, you know, elderly patients with dementia, Alzheimer's, psychiatric patients, patients with intellectual disabilities, patients with ASD, any vulnerable members of society, patients that maybe have poor English even. These are all very vulnerable patients when they're in the hospital, and their safety should be paramount. And they're just going on here. I'll just fly down through a few of these. There's so many, I suppose, cases of sexual abuse in hospitals, not just here in Ireland now, just like everywhere. And it's just shown how, like, particularly female patients are being put at risk in the hospitals when we have these male nurses and male medical assistants that are doing intimate procedures. Like, if there's ever an intimate procedure to be done on a female, it should always be done by a female, by a woman, not males. And I'm just going to read out a few of these here. You have Illinois hospital sued for male nurse sexually assault of patient. Woman suing hospital says male nurse touched her inappropriately. Jury awards a woman 65 million in a punitive damages after she's sexually abused at a Tarzanian hospital. We have nurse's assistant molested woman in his care. Nurse molested female patients in emergency room. 6 women, 3 nursing homes, and the man accused of rape and abuse. Now, look, this is just, you know, at the tip of the iceberg. Just want to go on about, like, here in Ireland too, you know, we've had several cases. We've had cases there of the nursing home where there was, you know, very elderly women with dementia being raped here in Ireland. We've also had a case there recently enough. There was a male nurse. I think he was doing the bloods actually, but you can look all these up yourself. You can Google them. And there was 2 people in his care sexually molested. I think there was a young girl. So why I'm making this video is I want to bring this to everyone's attention. If you are a woman watching this video today, please share this video with all your female friends. As I said, your mothers, your sisters, your daughters, because this could be you. You know, you could be in this situation. Your mother could be in this situation. Your sister could be in this situation. Your daughter could be in this situation. You know, we need to speak up now, us women, and we need to, you know, have this discussion, because no one else is having this discussion. I don't hear any politicians and no TDs or nobody from the HSE is having this discussion of the safety of women in the Irish hospitals. It's not been had, like. And I do believe as well with this video, if you want to share, now again, it's totally up to yourself. If you want to share, if you've had an experience, just please share it in the comments, because I'd love to get people just to get the courage to speak out. Or if you were in a hospital and you witnessed something that you thought was ethically and morally wrong, or where you thought a woman was put in a compromised position, where her dignity was taken, where her humanity was taken, and where she was demeaned, please, you know, share it in the comments, because we need to get this conversation started and we need to get it out there. Just a few suggestions as well for females if you're in the hospital as well. Just know that you have rights, you have patient rights, and you have a right at all times, right? There is a thing called consent, and you have a right at all times. If you do not feel safe, or you have someone that's trying to do some procedure on you and you are not comfortable, say no, or ask for a female to be present, ask for a female nurse, ask for a female nursing assistant. And, you know, don't be afraid. And I know it's easier said than done. And I know when people are very sick, they're very vulnerable. And when people are in pain. And that's why I would also say to family members as well, you know, if you have a member of your family in the hospital, like, you know, watch out for them, be their voice, be their advocate, speak up for them. Because like they are vulnerable, they are sick, they, you know, it's probably one of the most vulnerable times in your life is when you aren't feeling well and when you are sick and you need somebody there to be an advocate for you. So I just want to get this conversation started, get people talking about it. I just don't know why this is happening in Ireland, in our Irish hospitals. Male nurse assistants changing nappies and washing people. I just think it's, in my personal opinion, I think it's disgusting. I absolutely think it's disgusting. And I can't believe that we're just at this level of healthcare in Ireland. It's horrible, it's embarrassing. And shame on Ireland to be doing this to the women. That they're going into these hospitals. Like, as I said, in my own experience, right, to witness a woman crying after she's been bathed and seeing it with your own eyes that she did not want to be washed by that male nurse assistant. Now, there was a female nurse assistant present also, but that doesn't matter. Why was the male there? Why couldn't there have been two female nurse assistants? It's not right. You know, women have rights, patients have rights, women have dignity, they, you know, and they need to be treated with respect. I think it's even like mad that I'm making a video on this. Like, you know, this day and age, you think that women go into hospitals, they should be safe, like, and they should be, but they're not. And I really would love to hear other people's thoughts on this. I know I'm not alone on this. I know, and I do know of certain cases that I just can't talk about because the people that it happened to, they don't want to come public on it. But there is a lot of other stories out there, and I'm just asking people, get the strength, get the courage, and speak up. Because if we can get more people speaking up, well then women and girls are going to be safer in our Irish hospitals. And this is what the video is about. It's about bringing it out to the public, getting people talking. Because as I said, the politicians aren't talking, the HSE aren't talking, and there is a problem. It's an elephant in the room. It's a problem. And there are victims, you know, you can Google it yourself, you can see plenty of victims. You know, like, hard questions need to be asked. You know, why is there male nurse assistants and male nurses doing intimate procedures on women in hospitals? You know, are these people vetted as well? You know, we don't know if they're vetted or not. And, like, just to speak about vetted as well, like, a person could be vetted and, you know, they come up, you know, no convictions, but, you know, there's a lot of people too, they are doing nefarious things and they just haven't been caught. But I just think that women should never ever be put in that position in a hospital where they feel unsafe, where they feel like their dignity is being taken from them and that they're being demeaned. You know, like, you know, put yourself in that position for any woman. You're in the hospital, you're not feeling well, you could be in severe distress, you could be in severe pain, and then you get this male nurse assistant coming into you at a very vulnerable moment in your life, you know, bathing you. Like, I just think it's nuts, and I just couldn't believe that the health system is in Ireland, that we're at this level now, you know. And I just can't believe that there isn't a lot more people talking about this, because people should be screaming this from the rooftops, you know. You know, where are the feminist groups, you know? Where are all these feminists? They're not talking, you know, they usually talk about certain, I suppose, topics. But this topic needs to be blown out of the water, and it needs to be spoken about. And I just want to say, my own personal experience, I've nothing to hide here. It happened to me in Limerick, in the University Hospital Limerick. Also where I seen that poor woman who didn't want to be bathed by the male nurse's aide. That happened in Limerick as well, in the University Hospital Limerick. And when I saw that poor lady with the dementia and clearly being highly distressed and agitated and telling there was a woman, nurse's assistant and male, telling him to go away. I witnessed that as well. And that was in St. John's Hospital in Limerick. And, you know, we need to start calling this out now. What is happening in our Irish hospitals to women? And I just want to go back as well, like to women, you know, with dementia. And it's not just women, it's men with dementia. These are very, very, very vulnerable people. And there should be safeguards in place for these people. And I just think it's disgusting in this country that we have vulnerable people that have no voice and cannot speak for themselves, and they're being, you know, put into these positions. Like, you know, like nobody knows in the morning that any member of your family could have dementia and could end up inside in a hospital. And to think that they're going to be treated like that. Do you know what I mean? This, like what I witnessed, the woman was highly agitated and was telling him to go away from her. You know, like this big man coming in behind a curtain, you know, and they're taking her nappy off. It's just vile. It's absolutely vile. And I'm asking and calling on people, like, speak up. You know, don't be letting this happen. You know, there's enough stuff happening in this country and people need to speak up. You know, share your stories. And there's no point, like, speaking up amongst yourself or, you know, sharing it with family members. You know, you have to come out and bring it out to the public, because otherwise there's not going to be change. And as we're doing this video here today, in Ireland, in our hospitals, there's some poor woman, okay, getting their nappy changed by a male nurse assistant. Probably agitated, screaming, go away, leave me alone. And they've no voice. So please be their voice today. There could be somebody else then, a young, vulnerable girl as well, somewhere in our hospitals up and down the country, being baited by a male nurse assistant. And no, they've no voice. Now, when I was just reading there about the stories, they did talk about consent. And, like, where is the consent? You know, these vulnerable patients, like, where is their consent? You know, you got your blue curtain there around the bed and a male nurse assistant comes in. And as I said, a female nurse assistant may come in with them. But, like, if that person is agitated and they're distressed and they don't want to be washed, or the male is making them feel uncomfortable, that male should be removed straight away and just bring in another woman. You know, it's not rocket science. It's not hard to solve. It's like, how did we come to this? Like, how did Ireland come to this? And Ireland loves to say that they're so progressive, which is the biggest load of BS I've ever heard, because Ireland isn't progressive. And the more they say they're progressive, it's projection, the more they're not progressive. You know, we have to, you know, look after our women. And, you know, women have to be safe too in their environment. You know what I mean? We can't have this happening in our Irish hospitals. We can't have women being in wards subjected to this and nobody speaking out. You know, and that's why I'm sharing it today. And just please share the video. And I want to get more people talking about this. And I'd love to hear other people's, as I said, their stories. And I'd love to hear, you know, did you experience this in a hospital? Were you visiting somebody in a hospital or in a nursing home? Did you see something that you were not comfortable with? Did you see a woman in distress? Did you see a woman being baited, nappy changed, or being in a vulnerable position by a male nurse assistant or even a male nurse? These, you know, this has to be spoken about. We need to bring it out into the public now. I'm just trying to think if I anything to add on it. Just if you've got family members in the hospital, just, you know, be their advocate. As I said, they're very vulnerable, and particularly our female patients. Just another thing as well, like, I don't want to make the video too long, but just to touch on, I suppose, you know, there's a whole other section of gynecology and women and their experiences there, and we know a lot of women have horrific experiences there, even, you know, childbirth, and like, I suppose that would be a whole other video, because I don't want to get too sidetracked here. But I just think bring it out into the open today. You know, just let's get people talking, and please, in the comments, share your experiences. As I said, if you have witnessed something that you thought was demeaning to a woman in a hospital, or if you have been a victim yourself. And I know some people don't want to talk about this, and as I said, they want to come out and just block it and pretend it never happened. And you know, I understand that, and I do understand, like, it's hard to talk about. But if you're in a position that you can speak, please do, just for the sake of all mammies out there, sisters out there, and daughters out there, just to protect them in the Irish hospitals. Like, I don't think any TD is going to touch this subject or going to say anything. And the HSE certainly are not. And if anything, they're going to just try cover up all this and try to pretend, oh, sure, women don't mind. Like, I mean, please, please. How insulting is that to women? So, okay, that's it, lads. That's the video. As I said, like, subscribe, share. Please leave in the comments if you have experienced any of this. As I said, I'm throwing this video out there to get to highlight it, bring it to the public attention, get people talking, and it's only by that we're going to get change. And it is, at the end of the day, if you want change, it's down to the people. What I would have to say to people, like stop looking at your politicians and your government and all your government HSCs and whatnot. You're not going to get change there, okay? We all know that. It's up to the people now. Find the courage to speak up for your loved ones, for your family members, for, you know, your females in your family. And as I said, I don't want to just completely say, oh, this is all females, because, you know, males experience demeaning treatment in hospitals as well. But I suppose why I'm more focusing on the females is I am a female, and I just wanted to speak about my experience, what I witnessed, which was all with females, and just for the reason as well that most sexual abuse and sexual assault does happen to women. I'm not saying it doesn't happen to men. Yes, of course it does, but it's mostly, the rates for women are so much higher because women are in such more of a vulnerable position. So that's it, people, for today. Until the next one, as I said, like, subscribe, share. Please share this with all your female friends and families. Be the voice for change. Thank you, and bye.